benefits of using the miHealth is the ease of use and the ability to take it anywhere.
So I took the miHealth and put it on joint and just put it right on my neck, and after like 5 treatments, I'm like, that all just went away. I'm like, I am adjusting myself. This is really cool. Amazing.
You've got a headache, you've got a feature on there for that. You just got your little pocket doctor with you and you just select whatever features necessary. You can use it on body, off body. It's a good little handy tool to have around to keep your health in check.
And the first thing I did was go to miHealth and play with that, and had to learn how to use it. And I found it effective on pain. I found it effective on burns, particularly. So it was very useful for that. But there was more that I didn't understand, so I had to go further. That's where we got into this and tried to understand the whole aspect of the body field and how we had to look at the whole person, the whole energetic field, to try and get people better.
I've never seen anything like it before, but it was a lot of the things that he was mentioning kind of started to make sense. The knee part really struck me because it wasn't something that I had talked about, but it was still picked up.
Works very similar to acupuncture, but I think even more effective.
When I said, well, treat me for something that came up, she said, well, what's bothering you today? I said, I slept funny, my shoulder. And so she looked at the screen and found something, and now, of course, I know she was setting it for one of the ERs. And she treated my shoulder for a couple minutes and said, you see a difference? I said, no. So she looked back at the screen and set it for something else and treated it for that. She said, you see a difference now? And I said, no, thinking, really, these things don't work anyway. And then she said, do you mind if I touch you? And I said, no, not at all. She said, let's go to some place where, you know, you won't take your shirt off in the public. And she set it for a contact setting and treated it, and got rid of the pain by like 80% in 2 minutes. And nobody else that had ever treated me with any other device, and these are expensive devices from Germany and Russia and whatever, had ever shown me any benefit whatsoever. And that made me think, okay, I need to learn more about this.
Her foot was completely wrapped up, and I'm like, oh my gosh, what happened? And sure enough, she had gotten new shoes, and I warned her 2 weeks ago. I said, Kathy, those do not support you well enough, and look at the way you're walking, and you're kind of off balance. So I told her about that, and I said, just watch it. I said, you might need some support. And so today, she came to me and she said, I had been to the doctor, my foot is all wrapped up because it's swelled up. We didn't know what was happening. The doctor seemed to think that it was a sprained ankle. And then she says, let's just check your blood and see if there's any uric acid. There's a condition called gout that actually will swell up different joints of the body, the knees, the foot, the big toe. In this case, that's what happened to her. So anyway, I said, oh, let's use the miHealth. And so I used the miHealth on her ankle. She actually did it herself, and we used it for acute balance. First for about 10 minutes, and then I iced it for about 5 minutes. We could actually see the swelling going down as she was working the miHealth with the acute balance. And then I actually used it for another 5 minutes using the myofascial. And then she's going to go home and ice it. But when she got up to say goodbye, I said, Kathy, how's your foot? And she said, I don't feel anything. I said, no pain? And she said, no pain.
Well, before there was a big bulge here, and it was pretty red too. And then up here by my toe, because when we took off the ace bandage, it was just like ready to pop out. And now it's almost down to a normal, you know, and you don't see the big finger, you know, the big marks like when you push into a marshmallow.
Second patient that was really surprising came in. I've been treating them for many, many years. They're in their 80s. And I said, I've got a new toy. So I'm going to scan you on this. And they said, fine, you know, whatever. I put their information in, scan them. And toes was one of the things that came up on this older woman. And I said, toes? You haven't had any problems with your toes? And she said, yeah, my toes have all been really swollen for the last 2 weeks. I can't even move them inside my shoes. So I put the toes program into the miHealth. And while I was setting it up to scan her husband, I've got my hand on the miHealth and I'm down, you know, going around her toes while I'm inputting her husband's information. And all of a sudden she said, that's weird. And I said, what's weird? She said, the swelling's going down. I can move my toes.
It was really fascinating. It was really interesting to see where things showed up, and the sensation of the device on the hand was really interesting is the only way to describe it. Where it'll go from not feeling anything to just having like really intense sensation or vibrations, and seeing where it goes in different parts of the hand and how it responds differently. So the most amazing thing was the device itself and how it responded and interacted with my body and my energy field as I was moving around to different locations on the hand, and there was just a wide range of the level of intensity of the sensation that I was that I was feeling as I moved it to different places, and that was the only thing I was doing, was just moving it. I wasn't adjusting the device, so that was really pretty incredible.
I have a client with cerebral palsy who's been on infuceuticals for 3 sessions. When she came to me, her left hand was bald in a circle like this, and after doing the miHealth, she was able to straighten out and she would stutter, her words she wouldn't be able to speak clearly, and she was able to finish conversations, and her mother was able to tell her, "You're sounding so good over the phone." And so there's a lot of confidence building for her, and sleeping better, and then to have access to her hand again, even just after three sessions. She had heard of our practice from a friend who had been here, and she came in, we did a consultation, we did a Nest scan, we then took her into a treatment room and did a miHealth treatment with her, and then she started on her first round of infuceuticals. The hand energy and feet energy came up on her scan, as well as a lot of throat chakra, throat mucosa came up, if I can remember correctly. And so we just treated her with miHealth and followed the protocols.
With my extensive background in yoga and alternative medicines, when you have blockages in meridians, your body cannot heal, it cannot function. The frequencies from the miHealth plays a huge role with the meridians, but what I find that is fascinating with the miHealth is knowing what I do know about the meridian pathways. Our nervous system, the nerves follow the meridian pathways as well. So when you're activating the nerves, and I use the nerve on most every case I work on, because it is right along the pathways of the meridians, and it sends signals to unblock these. I work on getting the emotions calmed down, to get into a parasympathetic state before I run the treatments. And with the Nest, the miHealth, I do use the ESRs and also the ES8, or the chill. These work beautifully to help get into a relaxed parasympathetic state to heal. And I use that, and then I work with the protocols. Well, emotional trauma can come from many things. It can be chemical, it can be emotional, it can be physical. They all affect the body in the same way. We stay in a revved up state so that we can't calm down. This is why meditation has become so prevalent today, is trying to create a parasympathetic state so we can function. For some people that are in an acute state, I will use the ESRs. Also, the miHealth has an inner peace protocol that is very, very powerful. And this is a very good one to use, the inner peace protocol, to help create a parasympathetic state.
As an elite athlete, once you get to a certain level, everyone's talented. So it's not like an issue of like who's the most talented. Everyone's got major talent. No one is going to get to the Olympic final unless they're majorly talented. So the things that are going to make the difference are the little details, the nutrition, the health, how well you're sleeping, what's your energy like, what's your emotional state like, and that is where NES Health and the miHealth come into play. As an athlete, when you go into work, you use yourself to get your job done. So if your body and your mind is out of line and not in alignment and not working properly, you can't do your job. So it's important that everything is in alignment, and the whole system, the miHealth, and getting regular scans and things are definitely an advantage over regular therapy. After training, if your muscles are fatigued, there's a feature on there for that. You haven't got to pop any aspirins or cold remedy. Sometimes I don't really expect to feel anything immediate. So like if I put on in a piece, I might use that before I go to sleep. So just go off and peacefully sleep. Or like earlier today, I had a hard training session. And sometimes with athletics and some of the tough training sessions, you get these like pounding headaches after your run, and it's amazing how quickly the headache just goes, and that's not normal. Like normally I'd have to lay there for ages and then test, lift my head up a bit, see if the headache's gone. No, not gone. Lie back down, and it's just like, oh yeah, okay, I'm cool, I'm good now. Having that hands-on and one-on-one has been a great experience, but also just the daily, knowing that I'm doing something daily that is helping me, not just physically but energy and emotionally. That's really important to me, because I've had a lot of things in my life that have made things get out of balance, and to know that I'm working on that on a deeper level is very important to me, especially as this will probably be my last year in athletics. I want it to be a good one. It's one of those things that you have to just do it. You just have to try it and experience it for yourself, because with this, I think it's so broad and it can help you in so many ways. Before you have any preconceived ideas about what else is out there, there's nothing else out there like it. So, people always want to say, well, is it like a TENS machine or an ultrasound, or is it, there is nothing like it really. So it's hard to explain, but I think it's one of those things, you just try it and see for yourself. And once you use the system, there's no doubt that you'll see some results, and then you won't turn back.